Hi everyone, my name is Dr. Rosie Alistair and I'm glad you could make it along today for this webinar. This talk is about burnout and compassion fatigue and what veterinary professionals need to know. I'm going to think about burnout and compassion fatigue by considering three things. First, the bigger picture. Context is really important in both burnout and compassion fatigue. Second, what they are, including what causes burnout and compassion fatigue and how we can identify them. Then lastly, and importantly, what helps, including what we can do right now, either as managers or if this is something we're experiencing ourselves. I mentioned context is important. It's very important in burnout and compassion fatigue. The biggest misstep I see in addressing burnout and compassion fatigue, and this is extremely common, is to look at them independent of the context they've occurred in. We'll come back to that. But there's also a risk when talking about them that we try and fit things that aren't burnout or compassion fatigue into those frameworks of understanding. It's important that we are aware of other experiences too. Veterinary professional work can be an amazing career, but there are lots of things that can cause difficulties in veterinary roles too. This list is not exhaustive for what veterinary professionals experience, but it's important that we consider all of these alongside burnout and compassion fatigue. It's also important that we consider causes. Again, this isn't an exhaustive list. Burnout and compassion fatigue aren't the only things going on for people. But in certain conditions, some of these things listed here, along with others, can contribute to burnout and compassion fatigue. We also need to consider positive factors, things like reward, life outside work, meaning in our work, connection in our work. Those can help moderate, and we'll be talking more about those later. So what are burnout and compassion fatigue? At their simplest, burnout is an imbalance of job demands and resources, and compassion fatigue is stress resulting from helping or wanting to help with suffering or trauma. There's more to both, and we'll come back to that shortly. But first, why does this matter right now? As you're all very well aware, there's a lot going on right now. There are challenges with veterinary and nursing and other staff's workload, with staffing, and those challenges are particularly acute right now in some sectors and regions, and with people being tired. It's understandable that people are exhausted right now. All this has also happened at a time when our ability to connect with others has been reduced and made much more challenging. Connection to others is hugely important, including in the workplace. We all need to feel valued, seen, heard and understood and cared about. And that is hard when we're deliberately separated and many staff are still working apart from colleagues with social and supportive peer interactions limited. Opportunities to decompress are important too, whether that's a moment to relax in a break space at work and laugh with a colleague, or whether it's time away. All of that has been harder. It leaves us feeling less ready to keep stepping up to the places we sometimes need to. Uncertainty and worry are important too, including fear of exposure and transmission. And those fears are not equal. We all have different situations of risk for ourselves and our loved ones, and those inequalities have impacted too. There's also been secondary trauma, witnessing suffering, which we'll return to later, and importantly, intersectional aspects. People haven't been affected equally by the pandemic. They never are. We know that minoritized communities, women, young people, and people already experiencing discrimination have been disproportionately affected. It's been the same storm, but different boats. We'll start with thinking about burnout. There's been some confusion in the media and elsewhere about burnout in recent years. To be clear, it's not an individual mental health condition. It's an occupational phenomenon, problems associated with employment in the International Classification of Disease 11. That distinction is important. I'll explain why shortly. Ideas around burnout started in the 1970s, and over the last 50 years, definitions have evolved. It's been defined in different ways, as an imbalance of job resources and demands, exhaustion, depersonalization, and perception of inefficacy, and a flat battery. Burnout is a structural problem. It can be described as a characteristic of work groups rather than simply an individual syndrome. Professor Christina Maslach, who's been integral to a lot of research on burnout, described a canary and their historic role as air quality detectors in mines. If the canary falls over, you don't blame it. If its song is affected, the problem is not with the canary. Blaming the canary isn't only unfair, it's unhelpful. There's a lot of concern about burnout right now, and there are important reasons for this. There are lots of studies with varying prevalence in vets, and fewer studies, but still some, in wider veterinary teams, and it depends very much on how you measure it. It's important that we remember also and distinguish acute stress, compassion fatigue, moral injury, and depression. There is some overlap between burnout and compassion fatigue, which I'll distinguish a bit more in a moment. So how might we recognise burnout? Professor Christina Maslach described 3 elements to burnout, and I've gone on to describe these a little bit more of how you might see them in a veterinary professional. The first one is exhaustion, and this might present as chronic physical and emotional exhaustion. It might get to feeling like, I can't take this place anymore, that feeling of dread going into work, just not wanting to be at work. The second is cynicism, and I've added sarcasm and loss of empathy. Loss of empathy can be a sign of burnout, being very frustrated, needing to rant or vent all the time, but it actually doesn't help when you do it. You can also see it in cruel jokes about clients and banter that you wouldn't want clients to hear. It's struggling to care. Feeling ineffective, feeling as though your work doesn't have value, that there's no point to it, or that it's pointless trying to change things because no one will listen to you anyway. Sometimes a feeling of inevitability of things going wrong, and a sense of powerlessness at work. There's other signs of burnout too, which might be described as job withdrawal, being dissatisfied at work, people being absent, intention to leave the job, being cynical, lower productivity, impaired quality of work. Burnout diminishes opportunities for positive experiences at work in several different ways. People may have decreased job satisfaction, reduced commitment to the job or the organisation. They may have a negative impact on their colleagues, unintentionally. There may be personal conflict, exhaustion, and also physical stress symptoms of different types. Maslach and Lita described 6 key risk factors for burnout. Workload, specifically a mismatch in workload, a mismatch in control, lack of appropriate rewards, loss of sense of positive connection with others in the workplace, perceived lack of fairness, and conflict between values. With these problems in place, burnout is more likely. But here starts to sit a solution as well. Get these areas right for staff: workload, control, reward, community, fairness, and values. Have these in place, and burnout becomes less likely. We're returning again to what helps later, but for our first round of considering, I want you to think about both intervention and prevention for burnout. It's not often you hear people talk about prevention for burnout, but it's very important that we consider it. I'd also like you to think about 3 levels: individual, workplace, and profession. And in thinking about both intervention and prevention, and about these 3 levels, individual, workplace, and profession, I'd like us to reflect that it doesn't make sense to keep pulling people out of the rivers if we don't also go upstream and understand and prevent why people are falling in. So what might interventions look like at individual, workplace, and profession level? Individual interventions might look like stress reduction programs, wellness, things like that. And here is one of the biggest challenges in burnout in the veterinary sector. Because if we look in the veterinary sector at the types of solutions that are widely proposed for burnout, they are almost all at the individual intervention level. But we know that burnout is an organisational phenomenon. It's something that happens within workplaces. It can be a characteristic of workplaces. And so focusing all our attention on individual interventions doesn't make a lot of sense. What might workplace interventions look like? Might be active listening and leadership, making sure that those leaders are empowered to respond. Really good support for line managers and giving line managers the power to respond in response to what they hear. Profession level interventions might be support, might be help, might be advocacy, might be workplace protections. So what does prevention look like? At the individual level, this might be job design, job crafting, so that people have meaning in their work, possibly training, skills development, opportunities to keep developing and thrive in the workplace and to feel effective in your work. Workplace interventions for prevention might be policy, working hours, culture, workload, might be resources. At the profession level, we're thinking about culture, but we need to go a bit deeper than just saying the word culture, because it's one of these things that I think can sometimes be used and can disguise a whole lot of other stuff. Some of this is about who has the power to make changes in a workplace and how those powers are used, who has the power to actually undertake prevention activities in professions. It's not just about saying let's put certain training skills on the curriculum in veterinary schools or in veterinary nursing training. It's actually about thinking quite systematically about how we work and how that affects us. There's also some veterinary specific workplace research looking at burnout. For co-workers, team effectiveness, communication, professional development, and preventing toxic team dynamics are all really important in helping with burnout. In early career, induction, out-of-hours support, responsibility that's actually proportionate with someone's experience, themes around professional identity, particularly being able to ask for help as a veterinary professional, aspects of our culture, peer support networks, and time for interests outside the profession can all help. And in studies on job and life satisfaction for veterinary professionals, things that are important to colleagues, pay, holidays, and effectiveness of the team. One of the things that comes through very strongly in research and veterinary practices is the importance of teams. And I think it's important that we stop and think about teams for a moment, because quite often people talk about resilience in the workplace. And I think it's probably more helpful to think about resilience as a characteristic that's seen in the bonds between people in teams rather than an individual level characteristic. Teams are hugely important. And we know the last year and a half has been incredibly difficult for teams. So thinking about how teams trust each other, how they work together, and how well they're functioning is really important just now. So we're also going to think about compassion fatigue. Compassion fatigue was first described in the 1990s in human nursing, and a lot of the research on it is focused on healthcare spaces. It was initially described by Johnson for nurses in an emergency unit who had lost the ability to nurture. An important aspect of compassion fatigue is also secondary trauma. This is where compassion fatigue is often really misunderstood in vet. Compassion fatigue is not being tired of being nice. Compassion fatigue is both burnout and exposure to secondary trauma. For that reason, newer definitions of compassion fatigue take this into account. I've highlighted the one that's most explanatory for what I'm talking about today. Compassion fatigue is the disengagement of caregivers from their patients, which culminates in a reduction or inability to feel empathy and compassion towards patients, and an inability to provide the patient care that's deemed appropriate. It's the loss of meaningful and purposeful interaction between caregivers and patients. So importantly, as this quote from Coetzee and Lashinghoo explains, it's not empathy that puts nurses at risk of developing compassion fatigue, but rather a lack of resources, inadequate positive feedback, and the nurse's response to personal distress. By acting on these three aspects, the risk of developing compassion fatigue can be addressed, which might help improve retention of a compassionate and committed workforce. So what are some signs of compassion fatigue? You'll notice they're similar to burnout, but slightly different, because obviously compassion fatigue involves an element of burnout. It also includes elements of secondary trauma, and you can see those in this list of signs. Exhaustion, but also anger and irritability, maybe negative coping behaviours like harmful alcohol and drug use, that reduced ability to feel sympathy and empathy, and a diminished sense of enjoyment or satisfaction with work. Absenteeism, sometimes avoidance of particular tasks that maybe remind the person of the situation where the secondary trauma has occurred. Impaired ability to make decisions and care for patients, intrusive thoughts. These things are all potential signs of compassion fatigue. As I've said, there are similarities with burnout, and we're going to go on to think a bit more about how those two things interrelate. In this relationship between burnout and compassion fatigue, there's another important factor we haven't mentioned yet, and that's compassion satisfaction. Compassion satisfaction is the positive aspect of working with need. Working with need can be incredibly rewarding and meaningful. You can see that relationship a bit more here. In the right conditions, compassion satisfaction can help to protect from compassion fatigue. Figley and Root wrote a really helpful booklet about vets and vet technicians and compassion fatigue, looking at what gave vet tech satisfaction. They found a number of different rewarding aspects of work. I want you to pause for a moment and think about what gives you compassion satisfaction at work. For the technicians in the study, helping and healing animals was very important. And we can start thinking about job crafting right away here, because making sure that people who find helping and healing animals rewarding still have that as part of their role, even when they perhaps advance in seniority or even when things are busy, is important. Working as a team, being exposed to thankful clients, using skills and learning new ones, daily contact with animals, and educating clients are important for the veterinary technicians in this study. Here is a more complex model of compassion fatigue. It's my last model in this session before we go on to what helps. But stick with it and you'll see how it all fits together. In any challenging situation, when we face need, we do something called resource appraisal. We make appraisal of demand relative to the resources we have, and those resources might be personal, they might be situational, they might be workplace related. If we're well resourced, we may view need as an opportunity to gain resource and have an empathetic focus on the patient. The kind of meaningful work a lot of us went into this type of work for. But if we're not well resourced, we may perceive need as a threat and end up what it's doing in this model called self-focus. There's then a step called processing. Our ability to process is based on a lot of different things, but it can be learned and it can be supported in places like reflective practice too. Looking at the area of self-focus, the first mode is experiential processing, which is also known as the mirror system. This is where we share emotion or experience resonance. Experiential processing is an involuntary affective reaction which matches an affective experience between the caregiver and patient, while propositional processing is voluntary controlled cognitive process that enables the caregiver to adopt the perspective of others. The second is propositional processing, which is also known as the mentalizing system, metacognition, or theory of mind. This is important because even in situations of reduced resource, the ability to do propositional processing can help move away from a path of feeling threatened by need that leads to compassion fatigue. Other focus in this model allows the caregiver to acknowledge or empathise with the patient in that similar feelings are felt by the caregiver and patient, while understanding those feelings are different from the caregiver's own. There's no confusion between the individuals. As you can see, these affect our ability to give compassionate care, but there's another factor that matters here too: feedback. Even in a well-resourced situation, negative feedback can cross to a path of compassion stress. It's hard to receive that kind of feedback when caring and giving so much of yourself. It's important to see also that compassion satisfaction can feed into resources and can actually self-reinforce. So what helps with compassion fatigue? 3 things: resources, individual resources, object, workplace resources, like CPD, training and management. Positive feedback, acknowledgement, reward, praise, genuinely feeling valued and recognised and seen in the workplace. Compassion-focused development, opportunities to reduce self-focused personal distress and increase empathy. And as you'll remember from the model we just looked at, that isn't about blaming individuals, it's about thinking, actually, what resources do these individuals have available to support them to achieve other focus? What training have they had to achieve that other focus? And other and self-focus don't mean not thinking about yourself or focusing completely on other people. It's actually to do with technically how you empathize. So it's not about not thinking about yourself. Self-care is really important and is different to self-focus. So what helps? What can people who are affected do? Important things to remember are that you're not alone and you're not to blame. It's important to think about resources, both workplace and personal, to take time to decompress, to find work that motivates you and fits with your values, to find somewhere that you're valued and rewarded, and get support, remembering it can get better. What can managers do? Acknowledgement, listening, very, very important. Prevention's important too, thinking about resources and staffing, and I know that that's really challenging right now. Job design, thinking about roles, making sure people have opportunities for compassion satisfaction, for meaningful work, for work that makes them feel effective. Responsibilities and thinking about support. Making sure people have time to rest and decompress, and making sure that managers have that time too. Not only for role modelling reasons, but because managers carry a lot of the difficulty at times like this, and it's important that they have rest and decompression as well. Positive feedback and thanks. It's also important to think about role modelling. As a manager, people do role model on us. If we tell people to take breaks and take none ourselves, it'll be more difficult for the other people in the practice to take breaks. Thinking about how we can offer containment for people's distress or worry or concerns, while also having support for ourselves and role modelling that it's okay to get help at difficult times. At the beginning of this talk, I spoke about difficulties we're facing right now in COVID, and I wanted to conclude on what we can do about this. The first is acknowledgement and thanks. Thanking staff for the challenging work undertaken through the pandemic and the way they've responded and supported each other is key. Evidence suggests appropriate acknowledgement of challenging work undertaken may support resilience. It's important as part of this also to recognise people may be experiencing difficulties and to make sure they've information about support that's available. Giving time to rest and recover. We've had many months of challenging work and adaptation, and many people are feeling depleted and tired. This is normal, given what we've been through, and it's important we recognise this and make space for veterinary professionals and other practice staff to rest and recover. This can include good facilities and structures for breaks at work, ensuring people are able to take leave, and sometimes other ideas for decompression as well. Horizontal and vertical supports. Horizontal supports are from peers and immediate colleagues at work. These are absolutely vital for day-to-day support and coping in veterinary workplaces. Giving staff time and good facilities for informal conversations such as breaks or debriefing after difficult cases supports veterinary workplace health and well-being. Vertical supports from line managers are crucial too and have a key role in mental health at work. Line managers should be supported and trained in active listening techniques and well supported and supervised themselves. To actively listen, you need to be empowered to respond. In supporting well-being, sleep, nutrition, physical activity, human connection and time for activities people enjoy have key roles in well-being. It's been difficult through the pandemic to maintain all of these at times, and this is a busy time of year for many veterinary practices, so making time and supporting activities that help people to maintain their well-being matter more than ever. For sense-making, the changes we've faced in the veterinary professions through the last months have been unprecedented, and many veterinary professionals have faced challenging situations. Creating spaces for professionals to process and make sense of these is important, particularly following ethical dilemmas and situations where staff have had to act outside their normal ways of working and felt compromised and exposed to morally distressing situations. Sense-making in these circumstances without blame may reduce the risk of psychological harm. Examples of spaces might be reflective practice sessions, Schwartz rounds, or other similar groups where peers can reflect, listen, and support each other. In summary, burnout is a structural problem and an occupational phenomenon. Solutions for burnout that only address individual intervention are incomplete. Compassion fatigue isn't because caring itself hurts, it's because of secondary trauma, exposure to others' suffering, and an imbalance of resources. Solutions for compassion fatigue need to involve opportunities to care in a way that matters to you, as well as the right level of resources and support. It's important to be aware of other causes of difficulties too, and most of all, to remember that it does get better. I wanted to finish by speaking about VetLife. VetLife is an independent charity available 24 hours a day to everyone in the veterinary community. Anybody who works in a veterinary practice or works in veterinary industry. You don't have to be a vet. It's available to veterinary nurses. It's available to other practice staff as well. You can call the helpline 24 hours a day, 365 days a year. For certain groups, there are other services as well. For veterinary nurses and for vets and for students, there's a professional health support service. And for some groups with eligibility, we can also offer in some circumstances financial support. So if you're struggling, please don't be on your own with it. Please give VetLife Helpline a call on 0303 040 2551 or email via our website, which you can find at www.vetlife.org.uk. Thank you.